and welcome to the August 5th, 2021 Hawthorne Huddle. And we're glad that you're here. Hope you're having a wonderful, wonderful week, being attentive, mindful of COVID-19, mindful of the threat, the danger of the Delta variant, and mindful of the need to reestablish protocols in the face of the threat. And we want to always be encouraging of each other and modeling for each other the proper protocol, and have conversations about the value and the safety, the efficacy of getting vaccinated, because there are those among us who are still doubting or unclear or denying. And while we respect everybody's ability to come to their own decision, we have an obligation to each other to be as clear as we can, to encourage people to act responsibly, not only for themselves, but for their children, for their neighbors, their neighborhood, people they don't know that they come in contact with. So with that, let us begin the program. So you have the agenda. And Diana, let me throw it to you just to welcome everybody.
Thank you again, everyone, for joining us this morning. I know it's real early, but these conversations that we have this time is very important in the morning. So I appreciate everyone being on, and those that are continuing to connect. With that being said, we have a dynamite program. We have a special company that's going to turn it back over to you, Mr. Al.
Okay, great. Well, I started off talking about COVID. Let's go straight to our COVID update from Luisa Pessoa-Brandão from Minneapolis Health Department. Luisa, good morning.
Good morning. And I'm going to share, I have a presentation that I'd like to share just so that I'm not just spouting numbers at you. So let me see if I can do this.
Okay.
Oh, I cannot share the screen. So
I think Ann can set you up to share. Or Andrew.
But I wanted to just start by
Sorry, I was just going to ask Luisa, do you have that green share screen button at the bottom
of the window? I do, but when I clicked it, oh, okay, now it's working. Before it told me that it wasn't able to. So let me see. Can you see something that says COVID update, Hawthorne Huddle? Okay, because I'm on my small screen, so I can't see multiple things. So just a quick update, and these numbers are of yesterday. I'm just doing the analysis on the data pull from today. But as of yesterday in Minneapolis, we've had 40,589 cases.
Andrew, I'm not seeing the screen share. Are you seeing it?
I am seeing it. Luisa, can you make it full screen? Maybe that will help right now. Go into presentation mode.
Okay,
I'm not seeing
if
it.
I can figure this out.
Is anyone else not seeing it?
Okay, well, if everybody else is seeing it, that's fine. It's just
I see it.
I see it.
All right.
Okay.
Okay.
So as I was saying, of those over 40,000 cases, almost 2,900 individuals have been hospitalized, and 616 of those admitted to an ICU, and unfortunately, 451 individuals have died as a result of their COVID infection. 79% of those deaths have been among those 65 and older. And the only thing I want to say about that, obviously a huge loss in terms of our elders, but also those 65 and older only make up about 8% of all of the cases, but almost 80% of all deaths. So definitely a disproportionate impact among those who are elder. And 51% of the deaths were among residents of long-term care and assisted living facilities. Obviously, that happened in the early days of the pandemic. We are not necessarily seeing that as much now. At one point, deaths among residents of long-term care and assisted living facilities was closer to 80% as well. So we've seen definitely a change in that, but wanted to just provide sort of, this is the larger picture, the overview. Obviously, we have been hearing in the news about the Delta variant and the increase in cases. And so just wanted to show you the screen here for what we've seen since June 1st. June 1st is sort of on the, the beginning of the graph. You can see that we were going down, numbers were going down. We hit sort of our lowest point for most, and this is it has the Minneapolis total in red and the dotted line, and then the top line in dark blue is among our Black residents. The kind of light blue is our Hispanic, Latinx residents, and white residents for reference. But we were going down, numbers were going down. We were at about 6 new cases per day on average. And in the last 2 weeks, those numbers have shot up. 52% of all of the infections diagnosed in the last 9 weeks have been diagnosed in the last 2 weeks. So just to put that in, 50% of all of the infections diagnosed in the last 9 weeks were diagnosed since July, middle of July. And the rates have just skyrocketed, and we are now seeing about 50 new cases per day, and those numbers are increasing every day. The numbers have increased for every racial ethnic group. You can see that it's a fairly steep increase. It's a fairly steep increase among our Black residents and Hispanic residents. And, not surprisingly, those are the 2 communities where we also have lower vaccination rates. So we are also seeing more hospitalizations and more severe disease in those, among those groups. I know that everyone is working hard on vaccination, and really this is a result of the rapid increase among cases with Delta variant. And you can see that just here in the national picture, the Delta variant is this orange line, and you can see this is the week ending in April 24th, and you can barely see, there's hardly any cases attributed to the Delta variant. At the beginning of June, it was about 2% of cases in the United States that were attributed to the Delta variant. And as this is the week ending July 17th, that's at 83%. And I think the week ending last 7/31, that number has gone up to something like 89%. So exponential growth in cases attributed to the Delta variant. This variant is more transmissible and has higher viral loads. So when you're infected, you produce more virus, which makes it more likely that you are going to transmit. And unfortunately, what we're seeing is, while the vaccine protects individuals from severe disease and from hospitalization, unfortunately, fully vaccinated individuals appear to be able to transmit the infection, in the same way that unvaccinated individuals. So even if you're fully vaccinated, if you are infected with the Delta variant, the viral loads that you develop in your body are such that you are equally capable of transmission, which was not what we saw with the Alpha variant, or the one that was more prevalent earlier this year. And there was the one that was originally identified in the UK. So that is the difference that we're seeing. And so while fully breakthrough cases or cases among fully vaccinated people are still rare, that's not a consolation. If you are one of those breakthrough cases, it's not a consolation, but it is still less than 1% of, in Minnesota, less than 1% of all of those that are fully vaccinated that are testing positive. It's a little different in different states, and the more transmission you have, the more likely you are to see breakthrough cases, and as well, the higher number of people you have vaccinated, the more you're going to see possibly some breakthrough cases, because if the majority of your population is vaccinated, you're going to see those. But so I wanted to just also show you the distribution for Minneapolis. You can see that the numbers, the proportion is the same. Our number of specimens that have been sequenced over the last couple of months has gone down because of as testing has gone down. But I wanted to show you this as well. Our picture in Minneapolis and in Minnesota is very similar to what we're seeing with the national picture as well. And then the only other piece is, I'm going to keep preaching, please get vaccinated. Yes, we're seeing cases among those that are fully vaccinated, but the likelihood of hospitalization is 8 or 9 times greater for those that are not fully vaccinated. The likelihood of having symptoms is also greater for those that have not been fully vaccinated, and as well as is the likelihood of death. So, COVID is still very much present. Unfortunately, with the advent of the Delta variant, it is very much back in the conversation, and so much so that CDC has changed some of their recommendations, and as well as, we have made some additional recommendations here in the city. And I see, it looks like there might be a couple of questions in the chat. I'm going to stop sharing and I'm happy to take any questions. Let's see. Okay, so there were no questions. It was just some additional information, but I'm happy to take any questions. The new recommendation from CDC is that if you are going indoors, even if fully vaccinated, wear a mask in areas of high or substantial transmission. Minneapolis is very much in the substantial transmission, an area of substantial transmission, as is Hennepin County and most of the Twin Cities Metro, if not all Twin Cities Metro counties, as well as a lot of other counties in greater Minnesota. We are also in the city, the city and the county and the park board and a few and other institutions have now mandated that in city-owned buildings, it will be required to have a mask when you enter, regardless of vaccination status. And all city employees will be required to wear masks when they are out and going into businesses. So for example, our health inspectors will be required to mask as they are going into establishments. Masking protects you and protects others. So it's something that we do for ourselves, but we also do for others. You could be asymptomatic and, and if you are infected, you could still infect someone else that may not be may have other issues. If you have family members that are, immunocompromised, that is something that you're doing for them as well. And then, we're starting, hopefully we can get this under control, because we all, we know that school is coming, school is about to start in about a month, and we all want our kids back in school and safely. And unfortunately, those 12 and under cannot be vaccinated. And we are needing additional safety data for that group in terms of clinical trials, and about 6 months worth of that. And unfortunately, most of those trials started in May or June. So we're still a ways out from having that full 6 months of data, which means that we're still a ways out from having an approved vaccine for those kiddos 11 and under. And so that's a large of the population that cannot, does not even have a chance to get vaccinated. They're not eligible for it. So again, happy to answer questions. And yes, Andrew, free testing is still available. So the Vault testing is still available at the at the airport, and you can still order a test online from the Minnesota Department of Health. I think there are still, even if you go into a clinic, if you're just doing a regular test, not a rapid test, most of those tests should still be free as well. But there's definitely still free testing sites that that are available. How is the increase among the Black community? So, this increase has happened just recently, in the last 2 weeks. And so I know that the state, MDH has been doing their press briefings again, which they hadn't been doing them regularly for a couple of months. We have our data on our website. We have been communicating with partners that work with those communities. And, part of me being here and also taking opportunities to talk with community organizations is part of it. And I think the other way it's hopefully being communicated overall is through news media and, but in terms of specifically events where this is being communicated with the African American community, I'm not sure if there are any happening. I know that we are for sure doing vaccination events within these communities and bringing out the information as we're doing those vaccination events.
Any other questions? Can you email that presentation to me, Louisa?
Sure. If you put your email in the
Sure.
chat, I'll make sure to get it to you.
I'll do that. And following up on Sean's question, do you have particular information about impact on Black and Brown people in Hawthorne, Jordan near North?
So I looked at the number of cases in Hawthorne, and those have actually not gone up at all. They've been very stable. It's been about 3 cases per week, 4 cases per week. I can look at looking at maybe the near North neighbor, the sort of a community of near North, and combining a series of neighborhoods and providing you some additional information on that. It's harder to look at patterns when the numbers are much smaller. It becomes a little more challenging to make any specific to distinguish patterns, because 1 or 2 case change can look very very different. So, but I can send you some information.
Please, yeah, I'd like that. Great report. It's alarming. I mean, as you are describing, the details, I get a sense of alarm, and or maybe it's overreacting. Are we moving into another state of emergency, particularly for the Black and Brown community? Am I overreacting, or? Well,
I think that the CDC has described this as at this point, a pandemic of the unvaccinated and people that have not. And so I think, for me, as someone that has been working in this for the last year and a half, I feel discouraged, and I am worried, because we've seen impact both for in both the Black, Brown, and Black community, as well as the Latinx community, disproportionate impact. The rates are 6, 7, 8 times higher than among the white community, and we've been trying to get this message out. I think there's been so much damage done with misinformation this past year around what COVID is and isn't, around the benefits of vaccination, and I understand that our fears of vaccination, given historical trauma, but we were so, and I can speak for me and my team, we were so excited when the vaccination began, because we thought, here it is, we can get a handle on this. And this is a very, it's a very smart and adaptable virus. And my concern is that all of the good work that went into getting these vaccinations, if we can't get enough people to get vaccinated, it will just give the possibility that there will be another variant that will be even more capable of escaping the benefit of the vaccine. And so for me, as a public health person, I don't think that you can overreact. I think,
Okay.
the message of vaccinate, 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 and protect, wear masks, continue to be vigilant is important. We are not out of this. I want us to be out of this. I think we can get out of it, but I think everybody's going to need to step up and do their part, both individually and as a community. And I think there's someone with their hand, Victoria.
Yes,
Sorry.
I have a couple of questions. I've been waiting patiently. First of all, is there any talk of a possible another shutdown?
Not not in the city and not at the state. So I know that, and I'm not as familiar with all of the pieces around the emergency powers, but I know that the last session, the last legislative session, the legislature removed some of the emergency powers that the governor had accessible to him. So I don't expect that we'll see anything from a state level. I also know that, I'm obviously providing data to the mayor, and at this time he is not looking at doing a shutdown at the city level, or even, he stopped short of a mask mandate. I could see that possibly changing if the numbers continue to increase, so what came out on, I think was yesterday, was really about city buildings and city employees, and then a strong recommendation for all residents to mask when they are going indoors. But at this point, I don't see a shutdown, any kind of shutdown orders, or those kinds of emergency orders. But in fact, the state of emergency order for Minneapolis is still through the end of September. So that is in place, and it gives the mayor some flexibility for doing additional things, but I don't see that happening. Now, it's not to say that it couldn't if the numbers continue, if we continue to see this increase,
Okay.
and it gets much worse.
Okay, I had another question. Since it looks like our children are going to be going back to school, is this new vaccine that they're coming up for our children, is it going to cover them for the COVID and all these different variants of strands that have come forth?
So the vaccine is still, the current vaccine, the vaccine that I've received, that, a lot of people have received, the Pfizer, the Moderna, the Johnson & Johnson, is still effective in terms of protecting from severe disease, for even for the Delta variant. So it still covers you, even though you might get infected, you might have high viral loads, you're still not going to get as sick, you're still not going to, end up in the hospital. So, vaccines are never 100% in protecting you from getting infected. They're more, they're still fairly effective in protecting you from severe disease. The vaccine that they're studying, the vaccines that are being studied for the 11 and under, they have, they're the same vaccines. They're basically, I think, looking at dosage because of the small bodies and some of those differences. They're looking at what is the dosage, and they may be able to, tweak it to have additional coverage for the variants, but I'm not sure of that. But it is, because the studies started or are being done when there was already some more knowledge of the variants, it is possible that they are looking at tweaking, the messaging that is in the vaccine around the spike protein and those things to make it more challenging for, say, something like the Delta variant to attach to your cells and begin replication of the virus in your body. But I'm not, I'm not a vaccine or a
Right.
microbiology expert, so
Right.
I'm not sure. But it is the same, it is the Pfizer, the Moderna, and the Johnson and Johnson that they are
Okay.
studying. And I think they really want to look, especially for younger kids, given some of the things that happen with the myocarditis and with a couple of other, rare events that have been noted now that we have so many, people being vaccinated, that was harder to look at they're really being more trying to look at more people in those younger age groups in those clinical trials, which is part of the delay, is that the FDA requested additional individuals be enrolled in those trials to provide better data on those rare events that could happen.
Okay. I have one more question, if it's okay.
Sure.
I am totally in agreement with you on this thing mutating once again. If people are not getting vaccinated, at what point, or is there a point? I mean, in my look at history with pandemic is concerned, it's like mandated. I mean, it's like you have to get the shot because people are dying.